Welcome back to another episode of Data Central. I'm Alfred Brock. Today's episode, entitled Type 2 Diabetes and Other Information, features a special health information narrative. Wayne County is listed as Michigan's most unhealthy county. In an effort to change that, citizens in Wayne City have been working together to encourage activity and learn more about health. Once a month, a group called Healthy Wayne meets at the Hype Recreation Center on Howe Road to talk and learn about healthy living. They also work on projects to promote healthy living and health awareness. What are some of the projects that they're working on? These include walking clubs, reviewing ways to identify and use resources that already exist in Wayne City, like parks, and to incorporate them into a healthy living lifestyle. They're also working with local restaurants and markets to promote healthy choices like fresh vegetables, lean meats, and other items that can support a healthy diet for breakfast, lunch, and dinner. If you're interested in participating, you can find them on Facebook or just make inquiry at the Hype Center. Now, one of the main problems in Wayne County is diabetes. Medical science has come a long way in treating diabetes. For example, let's take a quick look at a cutting-edge treatment from 1916, 102 years ago. It was called the starvation treatment of diabetes. What you were supposed to do was for 48 hours after admission to the hospital, the patient would be kept on an ordinary diet to determine the severity of diabetes. Then he is starved, and no food allowed save whiskey and black coffee. The whiskey is given in the coffee, 1 ounce of whiskey every 2 hours, from 7 a.m. until 7 p.m. This furnishes roughly about 800 calories. The whiskey is not an essential part of the treatment. It merely furnishes a few calories and keeps the patient more comfortable while he is being starved. If it is not desired to give whiskey, bouillon or any clear soup may be given instead. Now, right now we're going to come up to the modern times, and we're going to listen to some information provided by the American Diabetes Association on their website, www.diabetes.org. So that's www.diabetes.org. www.diabetes.org. I encourage you to visit it either through your home computer or one of the internet-ready computers at one of the local libraries. They have a great deal of positive information that will help you make informed decisions about your health. This information is provided as a jumping-off point only and should not be taken as direct medical advice from me. I'm offering it to you from the Diabetes Organization. Now, according to the American Diabetes Association, and I quote, "Diabetes is a problem with your body that causes blood glucose sugar levels to rise higher than normal. This is also called hyperglycemia. Type 2 diabetes is the most common form of diabetes. If you have type 2 diabetes, your body does not use insulin properly. This is called insulin resistance. At first, your pancreas makes extra insulin to make up for it, but over time it isn't able to keep up and can't make enough insulin to keep your blood glucose at normal levels. The facts about type 2 diabetes include type 2 diabetes is the most common form of diabetes. In type 2 diabetes, your body does not use insulin properly. This is called insulin resistance. At first, the pancreas makes extra insulin to make up for it, but over time, your pancreas isn't able to keep up and can't make enough insulin to keep your blood glucose levels normal. Type 2 is treated with lifestyle changes, oral medications, and insulin. When glucose builds up in the blood instead of going into cells, it can cause two problems. Right away, your cells may be starved for energy. Over time, high blood glucose levels may hurt your eyes, kidneys, nerves, or heart. Some people with type 2 can control their blood glucose with healthy eating and being active, but your doctor may need to also prescribe oral medications or insulin to help you meet your target blood glucose levels. Type 2 usually gets worse over time. Even if you don't need medications at first, you may need some later on. Some groups of people have higher risk for developing type 2 diabetes than others. Type 2 diabetes is more common in African Americans, Latinos, Native Americans, and Asian Americans and Pacific Islanders, as well as the aged population. So you get older, you may get it and have to deal with it. Diabetes is a common disease, yet every individual needs unique care. We encourage people, the Diabetes Organization does, with diabetes and their families to learn as much as possible about the latest medical therapies and approaches, as well as healthy lifestyle choices. Isn't that good? Good communication with a team of experts can help you feel in control and respond to changing needs. You are the most important person of your healthcare team. That's you. After all, you're the one who's affected by diabetes and cares for it every day. Only you know how you feel and what you're willing and able to do. You do the exercise, you make and eat the foods on your meal plan, you take the medicine or inject the insulin, you check your blood sugar, glucose levels, and keep track of the results, and of course, you're the first to notice any problems. Your healthcare team depends on you to talk to them honestly and to tell them how you feel. We're going to take a break now for a public service announcement and come back with some more information.
Gaining weight was easy. All I had to do was sit down and eat. Losing weight's a lot harder. I have to work at it every day. But with every step, I lower my risk for type 2 diabetes and heart disease. And that makes every step, every choice, every day very much worth the effort.
Hi, hon. How was your run?
Hard, but I hung in there and did my 2 miles. How was your workout?
Great. Dinner's ready. I hope you worked up an appetite.
Health female like this, you better believe it. Thanks for keeping us on track.
Hey, every step matters. We can do this.
And it's very much worth the effort.
Learn how you can help stop diabetes by losing weight, eating healthy, and staying active. Visit checkupamerica.org or call 1-800-DIABETES.
Now we're going to talk about some of your support team for type 2 diabetes. Remember, you're the captain. First of all, the primary care provider. The primary care provider, who may be a primary care or family practice physician, is who you see for general checkups when you get sick. A doctor with special training and usually certification in diseases such as diabetes is called an endocrinologist. If you do not see an endocrinologist, look for a primary doctor, family practice doctor, or an internist who has cared for many people with diabetes. Your primary care doctor may also be the one who refers you to specialists or other team members. Other healthcare providers who provide primary care include nurse practitioners and physician assistants, who typically work in collaboration with a physician. If you're looking for a new doctor, your visit should include some time for you to get to know each other. Make sure you feel comfortable talking about the details of your health and lifestyle with this doctor. You might ask some of these questions. Do you have special training in diabetes? Are most of your patients people with diabetes? Do you see more people with type 1 or type 2 diabetes? What tests will you do at regular office visits? How often will you order these? What days are you not here? Who covers on nights and weekends so I can get in touch with somebody if you're not available? What are your fees? Do you accept my insurance? That's important. Are you associated with other diabetes care professionals so I will benefit from a healthcare team? And do you refer to an educator or dietitian? Because I would like to talk to an educator and a dietitian. Okay. So your doctor support is important, of course. Your insurance plan may require you to get the doctor's referral for visits to other health professionals on the team. Before you leave the office, ask the staff about other details, such as how long a wait patients usually have. Does the doctor's schedule run on time? Is there a set call-in time when you can talk to the doctor on the phone? And what's the billing policy? After the visit, ask yourself, did the doctor really listen to my concerns? Was the doctor concerned about my diabetes control? Did the doctor answer my questions? Next up, we're going to talk about the nurse educator. A nurse educator or diabetes nurse practitioner is a registered nurse with special training, an RN, with special training and background in caring for and teaching people with diabetes. Many are certified diabetes educators, CDEs, and may have a master's degree. Nurse educators often help you learn the day-to-day aspects of diabetes self-care. They can teach you certain things like what diabetes is, how to cope with diabetes and to make changes in your health habits, how to use diabetes medications, how to work with insulin and give yourself shots, how to check your blood sugar, how to keep track of your diabetes, symptoms of low and high blood glucose, how to take care of an insulin reaction, how to handle sick days from work, or other things, right? How are you going to handle it when you get sick? How to stay healthy if you're pregnant. Now, a registered dietitian can be a trusted ally as well. A registered dietitian, an RD, is trained in nutrition and has passed a national exam. An RD may also have a master's degree or may be a certified diabetes educator, CDE. You may want to be sure to work with an RD who has training and experience with diabetes. If your doctor does not work with a dietitian, ask him to refer you to one. Your dietitian helps you figure out your food needs based on your desired weight, lifestyle, medication, and other health goals, such as lowering blood fat levels or blood pressure. Even if you've had diabetes for many years, a visit to the dietitian can help. For one thing, our food needs change as we age. Nutrition guidelines for people with diabetes also change from time to time. Dietitians can help you learn how the foods you eat affect your blood sugar and blood fat levels. They can help you balance food with medications and activity. They can teach you how to read food labels, to make a sick day meal plan, to plan meals, to plan for eating out and special events so you have a good time and don't have to worry about anything, to include ethnic or foreign foods into your meals. Some of them are really good and good for you. To find good cookbooks and to make food substitutions. Now, what is a CDE? A CDE is a Certified Diabetes Educator. We mentioned them a little bit. Now, CDE may be a nurse, dietitian, doctor, pharmacist, podiatrist, counselor, or exercise physiologist. Woo! These professionals all work in some way to teach or care for people with diabetes. They may work in hospitals, clinics, diabetes centers, or private offices. To become a CDE, a healthcare professional must pass a national test. The test covers physiology, drug treatment, blood glucose testing, complications, mental health issues, and teaching learning principles. CDEs must pass a recertification test every 5 years. So they got to be fresh. When you see the letter CDE after a healthcare professional's name, you know the person is specially trained in the care and treatment of people with diabetes. Now find a recognized education program near you. You can do that by going to the website we referred to earlier, and I'll talk about it again later, and it's going to be down at the bottom of this video. Yeah. Now bring in the endocrinologist. Come on. An endocrinologist is a doctor who specializes in treating diabetes and other diseases of the endocrine system, the body's system of glands that produce hormones that control the way the body works. The pancreas is part of the endocrine system, and insulin is one of the key hormones the body needs to function properly. Besides diabetes, endocrinologists treat diseases involving the bones, the pituitary gland, and the thyroid and adrenal gland, so you get a whole package deal with the endocrinologist. Many people with diabetes may never need to see an endocrinologist in order to take good care of their diabetes. Most people with type 1 diabetes do see an endocrinologist, especially when they're first diagnosed, and many people with type 2 diabetes may see an endocrinologist if they are having trouble getting their diabetes under control or are developing severe complications, and we don't want that to happen, right? But if they do, we've got people to help. Now, some doctors are referred to as diabetologists because they have taken a special interest in managing diabetes and its complications, and they may provide excellent diabetes care. However, diabetology is not a board-certified field or medicine like endocrinology. Check with the eye doctor. Got the eye stuff coming up. This doctor is another key member of your healthcare team because diabetes can affect the blood vessels in your eyes. In the eyes. When eye problems are caught early, they are very good treatments. The eye doctor will either be an ophthalmologist or an optometrist. The American Diabetes Association guidelines say you should see your eye doctor at least once a year, and these checkups are the best way to detect diabetic eye disease. Your eye doctor will check for any changes in your eyes. If there are changes, the doctor will treat the problem or refer you to another doctor with special training in that area. Be sure your eye doctor is familiar with how to spot and treat diabetic eye disease. It's a good idea to ask these questions. How many of your patients have diabetes? Do you perform eye surgery? Will you send regular reports to my primary care or diabetes physician? Well, now let's walk on. We're going to move on now to social worker, psychologist, psychiatrist, marriage and family therapist. Some of these professionals you may need. Mental health professionals help with the personal and emotional side of living with diabetes. A social worker must have a master's degree in social work, MSW, as well as training in individual, group, and family therapy. LCSW stands for Licensed Clinical Social Worker. This means the social worker has passed a state exam. Social workers may be able to help you find resources to help with your medical or financial needs and should hold a master's degree in social work, MSW, as well as having training in individual, group, and family therapy. Some social workers may even be able to help you cope with many concerns related to diabetes, including problems within the family and coping with workplace situations that may arise. A clinical psychologist who works directly with patients can have a master's or doctoral degree in psychology and is trained in individual, group, and family psychology. A few sessions with a psychologist might help during time of special stress, or on a long-term basis, a psychologist might help work on more lasting problems. Psychiatrist is a medical doctor who can prescribe medication to treat physical causes for emotional problems. Psychiatrists also provide counseling. Marriage and family therapists can help you with personal problems in family and marital relationships and problems on the job. These therapists should hold a master's or doctoral degree in mental health in a mental health field and have additional training in individual, family, and marriage therapy. Your feet are important, so let's check in on the podiatrist. This health professional is trained to treat feet and problems of the lower legs. Podiatrists have a Doctor of Podiatric Medicine, DPM degree from a College of Podiatry. They have also done a residency, which is a hospital training in podiatry. Okay? Diabetes makes you prone to poor blood flow and nerve damage in the lower leg, so it's something to watch out for, something to take care of. You may get infections more often. Sores, even small ones, can quickly turn into serious problems, so you got to watch out. Any foot sore or callus needs to be checked by a primary care doctor or podiatrist. Do not try to fix these yourself because you could cause an infection, but do inspect your feet daily for signs of trouble so you can get help, right? Get the service that you need. Podiatrists treat corns, calluses, and more serious problems. Questions for your podiatrist include, how many of your patients have diabetes? That's a good question, right? You want to get somebody who's got some information there. Are you familiar with the foot problems diabetes can cause? Will you work with my primary care doctor if needed? And now for the pharmacist. Let's move on to the pharmacist. Now, a pharmacist has a wealth of information on medicines and what's in them, how they interact with each other. Pharmacists are highly trained professionals who must know about the chemistry of the products they dispense and what effects, both good and bad, medications have on the body. Therefore, they can also give advice on whether and how any medication you take for your diabetes or other conditions could or will affect your blood glucose levels. It's important to find a pharmacy you like and stick with it. This way, the pharmacist can keep an accurate and up-to-date profile of your medical history, allergies, and medications. Pharmacists do more for you than fill your prescriptions. They alert you to the potential common or severe side effects of any drug you're going to take. With each new prescription, they can review your medication profile to see if any of your current medications might interact with your new prescription. So in addition to asking your diabetes care provider, you can ask your pharmacist to recommend over-the-counter medicines for colds or other minor illnesses. For example, if your pharmacist knows you take a sulfonylurea, sulfonylurea, he or she may recommend a cold medicine with little or no alcohol to avoid any possible interaction between the two medications. And here comes the dentist. The dentist can help a great deal. People with diabetes are at a somewhat greater risk for gum disease. The excess blood sugar in your mouth makes it a good home for bacteria, which leads to infection. See your dentist every 6 months and be sure to tell your dentist that you have diabetes when you go to see them. Moving is very important, so we can work with the exercise physiologist. Going to go exercise with the physiologist, with the exercise physiologist. Exercise plays a major role in your diabetes care. No matter which type of diabetes you have, exercise can help lower blood sugar, help your body better use insulin, and help control your weight. It can also improve your blood fat levels, reduce stress, and improve your overall fitness level. Isn't that great? Even if you have diabetic complications, ask your doctor about safe exercises you can do. You can still exercise. The best person to help you, as long as you talk to your doctor first. Okay. The best person to help you and your doctor plan your fitness program is someone trained in the scientific basis of exercise. Your doctor can help you look for someone with a master's or doctoral degree in exercise physiology, or for a licensed healthcare professional who has graduate training in exercise physiology. Certification from the American College of Sports Medicine is another sign that the person has the basic skills needed to plan a safe, effective exercise program. And always get your doctor's approval for any exercise program. Doctor's approval, very important. Get it, then exercise. Okay. Hey, this information was last reviewed on August 2nd, 2013, and it was last edited on March 9th, 2017. Again, you can find that at the www.diabetes.org, diabetes.org. Hey, that's it for the local news this time here. Let's take a look at a public service announcement, and we'll be back for a quick look at state and national items for this episode.
I want to thank everyone for making this day so special. Dad, you've been my inspiration. I love you.
I love you too.
And Mom, I miss you so much.
Type 2 diabetes steals the lives we cherish most. But it can be prevented. Almost 80 million Americans have prediabetes, but because prediabetes doesn't always have symptoms, 9 out of 10 people who have it don't even know it. Know your risk. More importantly, do something about it. Eat better, stay active, and lose weight. You have a lot to live for. Stop diabetes for yourself and the people you love. Learn how at checkupamerica.org or talk to your doctor.
Okay, let's take a look at the state news. From the state news, for the state news today, we have an update from the Michigan State Police. State Police motor carrier officers join forces to fight human trafficking, says the State Police Department internet webpage. You can contact MC Sergeant Danielle Stewart, MSP Commercial Vehicle Enforcement Division, if you have any questions at 517-284-3247, 517-284-3247. Let's read about it. January 16, 2018, during National Human Trafficking Awareness Month, Michigan State Police, the MSP, motor carrier officers are teaming up with officers from neighboring states to raise awareness of human trafficking, a very serious issue. From January 2nd through the 26th, MSP officers, Michigan State Police officers, would join with their colleagues in the Ohio State Highway Patrol, Illinois State Police, and Indiana State Police, along with the organization Truckers Against Trafficking, TAT, to educate motorists about the signs of human trafficking and to enforce laws that crack down on traffickers. Good to hear. Now, quote, the goal of this week-long multi-state human trafficking initiative is to raise awareness and educate those individuals in positions to observe human trafficking taking place, such as commercial motor vehicle drivers, public transportation companies, rest area attendants, and truck stop employees, stated Captain Michael Crum, commander of the Michigan State Police Commercial Vehicle Enforcement Division. These individuals are a force multiplier that can act as the eyes and ears of Michigan's highways, unquote. The Michigan State Police first partnered with TAT in 2015 and has since been recognized as a national leader in human trafficking awareness and education. For more information about TAT, that's TAT, visit truckersagainsttrafficking.org. That's truckersagainsttrafficking.org. TRUCKERSAGAINSTTRAFFICKING.org. It's going to be down there in the site, though, at the bottom there. Truckersagainsttrafficking.org, doing a great work, right? So, to report the human trafficking, if you know of any or suspect it, you can contact the National Human Trafficking Resource Center at 888-373-7888. That's 888-373-7888. Or text BE-FREE, capital B, lowercase e, capital F, lowercase R-E-E, to number 233733. So BE-FREE, text BE-FREE to 233733. Now, for the national news, we have the Michigan Meteor. If you noticed it, I missed it. Someone had to tell me about it. Okay, but in the late evening of January 16, 2018, the Michigan Meteor gave a thrill to just about everyone in the state when a sonic boom was heard and bright flashing lights turned the dark winter night brighter than day. Yep, that's the national one. Okay, that concludes the episode of Data Central coming to you from Wayne City, Michigan. Be healthy, be happy. See you next time.
Some risks are obviously not worth taking.
Watch where you're going!
Some aren't as obvious, but could be just as deadly. Like the risk for type 2 diabetes, especially if you're over 45 or overweight. Take the diabetes risk test. It's free and takes less than a minute. Type 2 diabetes is one risk you can't afford to take. So stop diabetes before it stops you.